So in this video we are going to finish up chapter 28. We just have a few things to talk about the female reproductive system, and then we're going to move on to chapter 29 and look at development. So when we were talking about the uterine or menstrual and ovarian cycles, we skipped over some initial definitions, and you'll find those in your chapter 28 outline on page 5. So if you can take a look at page 5, we have a few definitions that we want to talk about, and then we also want to look at the hormones that are involved in the uterine and ovarian cycles. So again, we're going to assume that we are on a 28-day cycle. The menstrual cycle and uterine cycle are synonymous. That is the cyclic change in the uterine endometrium. So it's looking at the changes in that functional zone as we go from sloughing it off in the first 5 days to it growing to become a very glandular, vascularized layer. The ovarian cycle is also monthly. It works on that 28-day cycle as well. And it's a series of events associated with the maturation of the egg, or ovum, or oocyte. The hormones that are involved. This illustration that you're looking at shows you those hormones. We're going to talk about them. They are will look similar to what we looked at in the male reproductive system. At the top, you can see we have the growth, the gonadotropin releasing hormone coming from the hypothalamus. And when that gonadotropin releasing hormone is released, it's going to come down here and affect the anterior pituitary gland and cause it to release FSH and LH. The FSH, a follicle stimulating hormone, does exactly what it says. It's going to affect the ovaries and cause those follicles to develop. So they're going to go from the primordial follicles to the primary follicle to the secondary follicle to the tertiary follicle. The LH is going to be secreted, and that's going to travel to the ovaries as well, and it will stimulate estrogen production in the ovary. It will also stimulate the secretion of progesterone in the corpus luteum. Estrogen, when it is secreted, and you can see estrogen has a whole bunch of arrows coming off of it because it does multiple things. The ones that I want you to know is that it can cause a positive reaction, and it'll actually cause an increase in the release of FSH and LH, which is what causes ovulation to occur about midway through the cycle. It's also responsible for muscle and bone growth, secondary sex characteristics for the female, and it will help maintain accessory glands and organs, and it helps with the stimulation of that endometrial growth in the uterus. Progesterone's big function is to maintain the endometrial layer of the uterus. Relaxin is another hormone that is released. This is often released towards the end of a pregnancy, and what its purpose is to relax the ligaments, make them a little less tight, as particularly in the pelvic bone. You want that pubic symphysis between the two pubic bones to be nice and stretchy, so that when the baby is being pushed out of the birth canal, those bones will stretch apart a little more than what they typically would, and allow that head to come through the pelvic cavity. All right, so that's looking at the hormones. Let's take a look at the mammary gland. You probably looked at the model of the mammary gland in lab, so this should look somewhat familiar. The most interesting thing to me about the mammary gland is that it's actually a modified sweat gland. So it's when you look at it, it has the same characteristics as some of those sweat glands that you have. It is located within the hypodermis, anterior to your pectoral muscles, both the pectoral major and the pectoral minor. It is composed of lobules, which you can see are these little tiny, almost looks like, for lack of a better word, grapes that you can kind of see here. And these lobules are the milk producing units within the glandular tissue, and then they are connected together by the lactiferous ducts, which will all eventually join up into lactiferous sinus and open up onto the at the nipple so that the milk can be released from the breast tissue.